Today's Deeper Dive with Dara Cam podcast is brought to you by the Lockwood Law Firm. The firm, founded by John Lockwood, is based in Tallahassee, Florida, and its attorneys have more than 40 years of combined experience in legal and regulatory policy matters. The Lockwood Law Firm specializes in the alcoholic beverage, cannabis, casino gaming, and healthcare industries. Visit lockwoodlawfirm.com for more information or to set up a consultation. Hello and welcome to a deeper dive with me, Dara Cam. I am super excited to introduce you all to today's special guest, Brown University School of Public Health Professor of Practice, Scott Rivkees. You might know him better because he was Florida's Surgeon General before and during the COVID pandemic. Welcome to a deeper dive, Professor. Should I call you Dr. Rivkees? Dr. Rivkees.
That sounds fine. Dara, thanks so much. It's such an honor to be here.
Well, you headed the state. Let's just jump right into it. We'll start with COVID, but a lot's happened since then. You were the Surgeon General during the COVID, which was pandemic, which was uncharted territory for everybody at the time. You're a pediatrician. We've learned a lot more about pandemics and COVID. What's one of the things you know now about COVID that you didn't know at the time?
First about the virus, one of the things that was so unique about COVID was that it spread differently than flu. And one of the things with COVID was that there was actually this period before people became sick, of the 2-3 days beforehand, where they had asymptomatic spread, which has made this virus so difficult to contain. And this is really different than flu, which have been the recent pandemics where you really are not contagious until you spread symptoms. So because of that, that presented some very special challenges in terms of our understanding of the virus and how we are going to contain the virus and how we are going to respond to the virus. So that's one of the major things from the virology point of view. And then I would say the other major thing that we learned during the pandemic is how important it is to have a coordinated national response to COVID so that the public, departments of health all across the country really have an understanding of what is the best way to respond to this virus, which was part of a new pandemic.
That leads me to where we're at right now, because I want to jump into where we're at right now. You left Florida. You are now at Brown. You're in Rhode Island. You've been writing a number of op-ed pieces criticizing, without naming any names, what seems to me Republican-led states' responses to the pandemic. Certainly the things that you have called attention to are things that are taking place in Florida. I'm not going to put you on the spot, but let's start with some of the things that you've called out in your op-eds. Let's start with a piece that you wrote that was headlined, "Denialism is Seeping into Legislation and Undermining Public Health." We'll talk about the 5 major characteristics of denialism, but tell me what spurred you to write that op-ed and what are you focusing on in that piece?
Yeah, it's a really important issue. So we were actually dealing with 2 pandemics over the past 3 years. Pandemic caused by a very serious COVID virus, but also the pandemic of misinformation and spreading of false information. And so what we're actually seeing is this misinformation, this false information, is tied in with discrediting of public health experts in medicine, individuals who are in the know of these particular subjects. And so what we're finding is that some individuals are denying the role of public health and are trying to enact legislation to curtail public health and also addressing other public health measures, such as certain types of regulations and things like that, that actually can protect the public in taking some of those very special tools and measures away from departments of public health all across the country.
Well, I said I wasn't going to put you on the spot, but I am going to put you on the spot. We have a governor in Florida and a surgeon general in Florida that are criticizing vaccinations, that are criticizing vaccines, who maintain that there are studies that show that vaccines harm young men. What say you? Does the research support that stance?
Yeah, so first of all, vaccines have played such an incredibly important role in public health well before COVID. Diseases that were fatal, cause very serious illnesses. We don't talk about
Smallpox, measles.
smallpox, measles, uh, chickenpox, meningitis, certain forms of hepatitis. These cause tremendous illness, tremendous suffering, and death. So many of these things are preventable now due to vaccines. Vaccines go through a very rigorous process of approval. Their safety is continuously monitored. Now, moving to this pandemic, first, we need to reflect on the fact that it is incredible that within a year of our first cases of COVID in the United States, we had a vaccine against this virus. So, just to put numbers in perspective, in the United States, there have been 110 million individuals known to have COVID, and there have been more than a million deaths. So we're dealing with a virus that has a case fatality rate of probably 1%. Let's balance that against vaccines. There have been more than 700 million doses of vaccine given in the United States. And as far as serious side effects, individuals who passed away due to the vaccine, it is extraordinarily small. So the notion that it
Less
is
than
better,
1%?
less than 0.0000,
So far less than the
and
number of deaths.
yeah, yeah, it's extraordinarily low. So if we look at things in balance, first of all, this virus causes effects all across lifespan, and you can become protected against it by having an infection, where we know that a million people have died from infections, versus being vaccinated, where more than 600 vaccine doses have been given, and the number of individuals who've had severe adverse effects to this vaccine are extraordinarily low. And then also, the safety is continuously being monitored. There's no support for the notion, and there's a lot of scientific information about this, that says the risk of the vaccine is greater than risk of illness across any spectrum of age, going from 6 months to 106 years of old, and for young.
So it's fake news.
Well, we say it's inaccurate.
Inaccurate. You're a professor. I'm playing a pundit on my podcast. I'm a writer, but these kinds of messages sent from the state surgeon general, you're not naming, again, I respect you not pointing the finger at anyone. Your pieces are all generalizing, but it is a fact that the state surgeon general, if you look on his Twitter, he repeatedly tweets about the dangers of the vaccinations. The governor now, Governor DeSantis, who's now running for president, he at one point was advocating for vaccinate while you were surgeon general, was advocating for vaccinations, and is now, refers to them as jabs. And and anytime he mentions jabs, brings up they want to jab 3 months old. So, babies. And, he seems to be on the anti vax train. So I'm coming at this not only as a reporter, but as a type 1 diabetic who has diabetes. We talked about this the other day. My listeners know I have type 1 diabetes. I have had diabetes, insulin dependent diabetes, for over 40 years, and I'm old. And so it was a very frightening time for me because I got pneumonia actually a year. I actually got pneumonia a month before the first case of COVID was diagnosed in the United States. And I was flat on my back. I almost died. I was unable, you see picture, you see like video of people tweeting from their hospital beds and doing, FaceTime videos from their hospital beds. I was too sick for 2 weeks to text, to phone, to do anything other than basically crawl to my front door when people would drop off sugar free Gatorade and things like that. So it was very similar. The symptoms of what I had was very similar to the symptoms of what people diagnosed with COVID had. It felt like an elephant was sitting on my chest, and I was, breathing broken glass, blah, blah, blah. And I'm just saying that because I spent over a year very, very isolated because of my medical condition and my age. And I know other people who did the same thing. And so now it seems like the message that we're getting from our state public health leaders and our political leaders is that this was no big deal. We didn't need to get the vaccination. As far as I understand, people are still dying of COVID. I know people personally who died of COVID. I'm not saying that I had COVID. I'm just saying that I had something that mirrored COVID that was life threatening. So, as a public health professional, Dr. Rivkees, how do you combat misinformation or disinformation or messages that are being sent to the public that say, all this hoopla about vaccinations protecting you, it's big pharma, or it's the left, or it's a hoax. I mean, what do? You personally are writing op-eds calling attention to this, but how do healthcare professionals address this? And how do patients like myself, how do we approach our doctors?
Right. First, I'm glad you
Sorry for the
recovered.
long monologue.
No, I feel bad that you were sick, and I'm glad that you have that you've recovered. So first of all, even before the pandemic started, we saw the attack on the scientific expert. We saw the attack on the medical expert. We saw individuals challenging climate change. Is it real? Is it not real? We saw individuals challenging educational philosophies, people who are not necessarily experts in the area. And there's no question during the pandemic, and I would say certainly going into the second year of the pandemic, this is when you really saw this incredible flurry of misinformation amplified by the megaphone of social media. And we've seen public health figures attacked all over the country, scientific experts attacked all over the country. And we've seen general erosion in confidence in physicians as well. Physicians used to be one of the most trusted members of society. So the question comes to this, is where does the public turn to for the authoritative source of information, particularly when it comes to the personal health issues? And this really relies on speaking to your physician. Physicians, nurse practitioners, physicians assistants, many healthcare providers, they they're up to date about COVID. They know the merits of vaccine, and these are individuals that you can speak to. Also, there's information by different medical organizations, established medical organizations that are out there, CDC, pediatrics, American Academy of Pediatrics. There are lots of groups out there that you can look to for a trusted source of information.
But when you have state leaders challenging those sources, challenging that research, challenging that data, how is a consumer, a healthcare consumer, how do you know? This is kind of like, I'm going to get on another soapbox. This is kind of my little, the terrible wonderful about the internet and about social media is, yes, it more people are exposed to more information, but isn't it true that they seem to be seeking out the information that reinforces what they believe they already know? And now we're in such a politically charged climate where it's tribal, and if you're political, the leaders that are affiliated with your political party say one thing about medicine. Some of them are trained, some of them aren't trained. Aren't you more likely to believe them than you are your healthcare professional? How do you walk that tightrope?
Yeah, but I think it's actually really simple. And that is, who do you go to when you're sick? Who do you go to for your antibiotics? Who do you go to for management of the health conditions that you have? Who do you go to for your routine physical each year? There's a certain level of trust that you have putting yourself, putting your family members, putting your children in the care of somebody in the healthcare community. So feel free to have an open discussion with these individuals that you trust for your health about these really important issues, many of which are politicized.
We will be right back with Dr. Scott Rivkees, professor of practice at Brown University School of Public Health, former Florida Surgeon General. We've got a lot more to dig into.
Here at Deeper Dive, we want to hear from you, the listeners. We invite you to send your questions, comments, and feedback to our mailbag. You can reach us at deeperdive@cityandstatefl.com. That's deeperdive@cityandstatefl.com. Get your 2 cents in by sending us an email.
Welcome back to A Deeper Dive with Dara. Okay, so that brings me to a recent op-ed piece that you wrote. The title of that, it appeared in The Hill, is "In Florida, Doctors Can Cite Succubus, but Educators Can't Teach Morrison." In medieval times, I'm reading from your lead, it was believed that pregnancy and certain medical conditions were caused by the demons incubus and succubus that would invade the body during sleep. As bizarre as it may seem, the role of spiritual demons influencing human reproduction was recently championed by a medical group leader, with other physicians standing nearby nodding in approval. Florida is one of many states that has passed legislation. Essentially, the way it was marketed is a physician, medical practitioners' First Amendment, protecting their First Amendment rights. So what that means is doctors cannot be punished for whatever they say if they espouse. I'm searching for the terms because I don't want to be inflammatory, but you touch on this legislation in your op-ed piece. Tell me what your concerns are about these types of laws and the effect they have on healthcare.
Yeah, so first of all, recently, Senate Bill 1580, it's titled Protection of Medical Confidence, and this goes into effect July 1st. And this actually has two parts to this. The first part is allowing physicians to deny care based upon their beliefs, and the second has to do with regulation of what we're not prohibiting regulation of what physicians say. So let's talk about the first part as well. So those of us in medicine, we care for everybody. This is our job. We sometimes are in uncomfortable situations caring for patients, but this is an obligation that you have when you go into medicine. And as I wrote in the article, this goes back to Hippocrates and medical students all across the country when they get their diploma, recite the Hippocratic Oath or a modification of it. When you see your doctor, you should not have to worry whether the physician will see or not based upon their own personal beliefs. So what we're seeing both in Florida and other states, what they call these medical conscience bills, is something that will undermine healthcare. Already we see massive shortages of physicians all across this country. So what this means, if your physician decides not to see you for any particular reason, it may be very difficult for you to find health care. So, for example, if a physician can refuse to take care of somebody uh, based upon their particular beliefs, let's suppose that person is gay, so suppose somebody's had an abortion in the past, suppose somebody shows up in the office wearing a political party they find objectionable, we have to ask ourselves, is this something that we want of our doctors? So let me pause there, and then I can go on to the second part about the.
Before you do, let me ask you, is it something we want of our doctors?
This is something, when we get our diplomas, our Hippocratic Oath says that we take care of everybody as though they are our own family members. So this is part of the creed of medicine.
So you're saying no. All right. So go on to part two, please.
Yeah, so the second part has to do with, you know, should physicians be allowed to say anything they want? So as I mentioned, during this pandemic, we saw this pandemic of misinformation, and we also saw this misinformation come from physicians and from some medical groups.
Ivermectin pops to mind.
Yep, yep. So absolutely. So that's a good example where uh, hydroxychloroquine, ivermectin, medications that have no proven medical benefit, medications that can also cause harm. But we saw physicians advocate for their use, and we actually saw telemedicine groups of physicians who had prescribed these medications to individuals out of state, even though they weren't following the science. So, you know, now one of the things that has happened is that the field of medicine has regulated its practice and its conduct for years. We have standards for medical school education, standards for people when they get residency training, standards for practitioner certifications. There are a number of medical boards, and what do these medical boards do is keep the public safe by making sure that physicians practice the standard of care. And typically, medical boards, organizations, credentialing groups within hospitals, we have policed ourselves. And so, if there's a member of university faculty who is saying things publicly that are wrong, that can actually lead to public harm, something that is very much different than what is the standard of care, these medical boards could have a conversation with these individuals and sometimes actually um, have disciplinary action. But what this new legislation basically says is that the ability of these regulatory forces to keep us safe by helping to corral misinformation, false information, public harmful information is no longer allowed to take place in certain areas.
I actually have one final question. I don't know if you're going to answer it or not, but I'm going to ask it anyway. Was there a moment in time when you knew that your time in Florida was over?
I would say, I very much enjoyed my time in Florida. I very much enjoyed the things we did, leading a Department of Health, leading the Department of Pediatrics, making it one of the best in the country. And I'm really proud of what we did while I was there in terms of how we battled COVID.
Dr. Scott Rivkees, former Surgeon General of Florida, now professor of practice at Brown University School of Public Medicine. Thank you so much for your time. I'm going to keep reading your op-eds, and I hope that you'll join us again.
Yeah, thank you so much, Dara. This was a really important conversation, and thank you for bringing attention to it.
A Deeper Dive with Dara is a podcast by City and State Florida, hosted by Dara Cam, produced by Ryan Daly, and music for the podcast was recorded by Periodic Labs LLC and performed by Ryan Daly and Danny Reyes.
Today's Deeper Dive with Dara Cam podcast is brought to you by the Lockwood Law Firm. The firm, founded by John Lockwood, is based in Tallahassee, Florida, and its attorneys have more than 40 years of combined experience in legal and regulatory policy matters. The Lockwood Law Firm specializes in the alcoholic beverage, cannabis, casino gaming, and healthcare industries. Visit lockwoodlawfirm.com for more information or to set up a consultation.